Now, there's a program which is known as the Drug Revolving Fund. So, the Drug Revolving Fund, usually abbreviated as DRF, is actually an initiative that is, the government could actually be collaborating with the World Health Organization, and the main aim is just to subsidize drugs. Do you understand? So some drugs, that they will actually be expensive for your citizens, and this could make that your citizens could have disease conditions related to these drugs, but because those drugs are expensive, they will not turn up. They will not want to buy them. So the government now is just trying to prioritize the health of the citizens and trying to actually reduce the cost of the drugs. So that's the concept of drug revolving fund. So that is a financing mechanism, and is designed to ensure the continuous availability of essential medicines in a health facility. Do you understand? Without this, the drugs could be so expensive, and the citizens will not be cushioned from that effect of what expenses, right? So it works by using an initial capital, often provided by the governors or donors, to procure drugs, which are then sold at very cheap rates. Okay, so the revenue is generated and to be reinvested into replenishing the stock, creating a self-sustaining cycle. So key features of a drug revolving fund is what you have: seed capital, which is usually provided by governments or NGOs or community contributors. Cost recovery, so the medicines are sold at prices that cover the procurement and handling and distribution cost. So the revenues from the sales will now be used to restock the drug. So this ensures sustainability. So prices are set to balance cost recovery with accessibility for patients, okay, thereby making them cheaper. So the objectives of a drug revolving fund just ensures that it guarantees that there's continuous supply of essential medicines. It makes it that people can be able to access drugs. It reduces dependency on irregular government budget or donor aid. Promotes equity. So regardless of how rich you are, regardless of how poor you are in a community, you are able to at least have the basic drugs that will keep you healthy. So it strengthens the health system financial sustainability. So advantages: it ensures that medicines are always available, encourages accountability and efficient use of resources, reduces reliance on external donors, builds community trust in the health facilities. So challenges: there's a risk of excluding poor patients if prices are too high. I don't know if you understand. So even the drug revolving fund, right, the subsidy has to be done properly. So sometimes, because it's a government thing, because it's not a private thing, people might tend to mismanage it. All right. Then sometimes the people handling it might now just add the price just to be having their cut. Do you understand? So it requires strong monitoring. You have to ensure that the system is workable. All right. So that's it for drug revolving fund.